WashingTECH.
Hey, it's Joe, and I don't have to tell you, relationships are critical in Washington. But how do you, A, find out who the key players are, and B, figure out how to reach out to them? Well, I want to tell you about Leadership Connect. It's been an absolute lifesaver for us as we expand our operations and outreach here at WashingTECH. Leadership Connect, it's the digital service used by top federal contractors and government affairs leaders to contact decision makers and develop those strategic relationships. Visit leadershipconnect.io and join the community. I love it, and I'm 100% sure you will too. That's leadershipconnect.io. Try it now.
If you know this data at the zip code level, which we can provide, you don't necessarily have to shut down a whole state.
Welcome to the WashingTECH Tech Policy Podcast.
From Washington, D.C.
with Joe Miller.
Joe Miller.
I'm taking a break. We've been doing this since what? September 2015? So this is our 5th anniversary coming up, and I'm taking August off. If Congress can do it, so can I, so can you. We'll be back here after Labor Day. So that'll be September 14th, which will be actually one day short of the 5th year mark since we launched and published our first episode on September 15th, 2015. So it's time to do absolutely nothing for a few weeks, or as close to nothing as we can get. That's really all I've got for you this week. But we've got one last interview. My guests today, 2 guests. Mike Alkire, you already know because he's been on the show before. He's the president of Premier Inc., which is the largest global supply chain technology company, healthcare technology company in the U.S. But Dr. Jonathan Slotkin is also joining me. His first time on the show. Jonathan's Chief Medical Officer at Contigo Health, a subsidiary of Premier, where he partners with health systems and employers to deliver the highest quality care at a fair price. He's a neurosurgeon and maintains a clinical practice caring for patients directly at Geisinger, where he's Associate Chief Medical Informatics Officer and Vice Chair of Neurosurgery. Mike Alkire and Jonathan Slotkin. Mike and Jonathan, welcome to the show.
Thanks for having us.
So, Premier, Mike, you were on several episodes ago. A lot has changed. I mean, things are changing rapidly. I think the last time we spoke, COVID-19 wasn't even a thing, or really wasn't necessarily something that was on our radar yet. Perhaps it should have been. But Premier works with hundreds of thousands of providers all over the country. And I'd love to hear more about Premier for those who aren't aware, and then also hear a little bit about how all of these changes have affected your supply chain working with all of these providers.
Thanks, Joe. And again, thanks for having us back on the show. So a couple things. Look, we know that this virus is hitting communities disproportionately. And we've really got to figure out ways to take down those barriers that are creating that. We have 2 major segments. One is we're one of the largest healthcare global supply chain companies. And really what that means is we help our healthcare systems get access to supplies at very, very low cost. And we're all about building out sustainable supply chains to ensure that our healthcare systems have access to PPE and pharmaceuticals, in the long run. So we're big into building out healthy markets, and I'll jump back to that in just a second. And then we have the second side of the business, which is focused on technology and services to really help our healthcare systems perform more effectively from a cost standpoint, from a quality and safety standpoint. We use that technology also and that capability to extend into other markets. So we work with large employers and help them work more closely with healthcare systems to build out, areas around centers of excellence. And Jonathan could get into a little bit of that as he was one of the key drivers around some of those programs. And then we also work with pharma a little bit as we think about, leveraging our data, identifying patients, that make a good match for a trial, and doing real world evidence studies. And that's really critical to our healthcare systems to ensure that they're using the right therapies at the right time on the right patients. But just to answer the second part of your question, it's really interesting on the supply chain. So we have a group purchasing organization, which obviously we're leveraging all of our volume to get great pricing for the healthcare systems. But we also, for almost 10 years, 8 or 9 years, we've been actually contract manufacturing products across the globe and domestically for both medical supplies as well as pharmaceuticals. And I'll tell you, one of the big learnings that has come out of this whole COVID is this incredible dependence that we've had on China. And quite frankly, I think China's taken advantage of it. And I can give you a couple of examples. But when the world had this unbelievable, obsessed demand for PPE, there were just a couple of policies that China enacted that just put more pressure on the entire supply chain, to include, it's a few weeks into the virus, everybody's looking now, for product. In some cases, there was demand 25 times more than the average demand for products on face masks and gloves and other personal protective attire. China took a position that they were going to review the quality of manufacturing that were producing those products. And that put like a 2 or 3 week crimp on the supply of products. And that was an interesting policy if you were talking about just, organizations that had never produced PPE before, but they actually enacted that policy on organizations that have been producing PPE for the U.S. for years. And obviously, all that did was exacerbate the situation, drive up the cost of products, and our healthcare systems had to be, pay more for those products because we had to protect our patients and we had to protect our frontline caregivers to ensure they had those products. So that was one. The other was, during the midst of all this, everybody was talking about the N95 face masks. China has a disproportionate amount of production for this product called filtration media that sits inside that N95 to ensure that you're not inhaling particles. They actually, stopped the shipment of that filtration media in the midst of all this. So even if you were a finished good manufacturer for N95s, we couldn't get access to, obviously, that raw material. So there's some lesson learned, and at the end, maybe I can wrap it up and summarize with some of those lessons. But right off the bat, I'll tell you, we've just got to do a much better job of diversifying the supply chain and ensuring that our healthcare systems have access from multiple sources for these critical products. But I'm going to defer to Jonathan, given he's one of those frontline folks.
Yeah, when we try to watch the flow of materials, PPE, plan procedures, watch ventilator usage, really a reliable supply chain is the critical underpinning of that infrastructure. Because everything that sits above that could be working perfectly. But if we don't have ventilators, or we don't have masks and gowns and gloves, all of those tasks that providers and provider systems need to perform are stymied. And the system starts to break down from there. So we could debate all day what is the public utility under all of our feet that makes the U.S. healthcare system run, and we could talk about it being the providers, which I'm one. But I think actually it's the supply chain, and when we have that diversified and not really a dependence on really one foreign country, our security in that supply chain and our U.S. healthcare system is going to really exponentially increase.
So the key here, if I'm hearing you correctly, is testing, tracking, tracing, surveillance, essentially. And Premier and Geisinger have developed a project and developed some technologies here. Tell us about what you've developed and tell us what you need for these things to be as effective as we need them to be.
We actually think it's really critical that we understand what's happening at the patient bedside in real time as clinicians are treating these patients. And we have the ability through some technologies that we've invested in to use machine learning identifiers or classifiers to look at the symptoms. And we can identify in sort of a real-time way with a high probability whether or not, there are these folks that are being treated, be it face-to-face or if they're being treated virtually, whether or not they potentially have COVID. And that's critical because the quicker we have that information, the more important it is, obviously, to healthcare officials and governors and others that are, responsible for public health, to understand where there's a potential surge of the virus or to understand where there's a high prevalence of the virus. So, our thesis is if you know this data at the zip code level, which we can provide, you don't necessarily have to shut down a whole state when you see the prevalence of a virus or a surge. You can shut down and I'm making it up, 9 or 10 zip codes where, there's a surging part of that population that has the virus.
Joe, the problem we needed to solve for is that existing syndromic surveillance. So that's the fancy term for our government state's ability to track rising illnesses. It's dramatically lacking. And I think it will surprise many of your listeners when they hear what those systems actually consist of. The existing state and federal disease surveillance really consists of reactive, non-real-time reporting of diseases that are picked up in emergency rooms. And these tools run on 20-year-old technology. They're not automated. And in some areas, clinicians and public health officials actually need to print data from hospital systems on a printer, manually fill in, and then fax reporting forms to public health officials. And some of these forms can take up to 30 minutes to fill out, with a lag sometimes between a patient receiving a positive test result and the reporting of that data as long as 7 days. And we know in COVID, when 7 days have passed, a lot of folks are getting quite ill at that point. So the nation desperately needs an automated, real-time, effective national and state surveillance system. And that was the impetus, for this work. So the team is set out to rapidly build this, an automated real-time tool for COVID-19 and other illnesses. And the speed with that the team moved in this was astonishing, really. And the goals were to build an application that can be used by health systems and hospitals, states, and the federal government to perform some really critical tasks that are lacking right now. And that is to know when COVID and other diseases are surging before the testing numbers tell us that. And they tell us that now days and weeks later. I have a patient that went and got a self-swab at a large pharmacy chain recently and got his COVID test result 14 days later, which if he had COVID and was going to end up on a ventilator, he'd be on a ventilator already. So we need that. And we need to also better determine which patients are more likely to become profoundly ill. And we have to be able to provide our hospital systems with the risk and the severity adjusted information needed to predict supplies and changes in supply chain. So this application, like Mike mentioned, it uses artificial intelligence, specifically for your listeners that are in these areas, natural language processing and machine learning, to scan doctors and hospitals' notes for hundreds and hundreds of phrases like trouble breathing or loss of taste, and other free text and data that relate to the signs and symptoms and other indicators of COVID or other infections. And so using this approach, hospital systems and increasingly states and eventually the federal government, when they recognize this, are going to be able to use this tool to rapidly identify patients who are presenting with COVID-19 and at the granular level take action, and also at the county and even larger level know when surges are happening and changes societally or to health systems need to take place.
And how is Geisinger approaching it specifically in Pennsylvania?
Yeah, there's so much opportunity in that area. And functions like contact tracing, they've usually, fallen under the auspices of local and state health departments. But we all know that so many of those resources right now, they're spread thin. And one estimate in a study described in Ars Technica found that the United States would need 300,000 contact tracers to do the job right. And obviously our country is well short of that number. So at Geisinger in Pennsylvania, one really neat thing is that we quickly realized that health systems like Geisinger are already expert in managing testing, communicating results, and treating those people who test positive. So we rapidly realized that we could view contact tracing as a public-private partnership. So Geisinger now has 24 employees spending significant parts of their work week on contact tracing in association with the state. And as of just a couple of weeks ago, this team had made over 3,000 phone calls related to the follow-up on over 2,000 positive patients. And Geisinger, we found that extending our capabilities to include contact tracing was a natural extension for a health system. So we think that health systems that have the resources to do this should consider doing it. And when they do, they'll directly benefit their patients, providers, and the communities that they serve. And as far as Premier more broadly and nationally, I'll bounce it over to Mike.
So a couple things. First, when all this happened, Premier was very instrumental in setting up a coalition to really focus on COVID. And the initial coalition was really all about getting, obviously, supplies to our healthcare providers, the frontline workers. And so we pulled together manufacturers, we pulled together distributors, we pulled together other GPOs, and working with FEMA and HHS. So, and that, was sort of the precursor to some of the strategies that the administration, HHS, and FEMA then initiated. Subsequently, we've been working with some of the federal agencies around building out technology really that can overlay on top of all these strategic stockpiles. It is very, very inefficient when you have the federal government trying to build out stockpiles. You have states trying to build stockpiles. You have healthcare systems. So everybody's trying to stockpile the exact same products. And as you can imagine, with a fairly narrow supply chain for most of these products, all it's doing is exacerbating the situation and keeping the price inflated.
Right.
So we've been sort of working to sort of ensure that the governmental agencies understand we have a technology that can look at the inventory levels and ordering experiences, or what our healthcare systems have been ordering, and provide that insight in a very, very quick period of time, so that it brings more efficiency to the whole process. The way that we describe it is it would allow an organization like the federal government to dynamically allocate product, understand where all these products are, and then if there was a need or we had significant surges, given the data that we have the ability to overlay on, you could, dynamically allocate the product. So that's number one. Number two, Jonathan sort of hit on this, and this has to obviously to go back to our syndromic surveillance. There's a lot of technology that's out there today. And there's and the whole focus on surveillance has been obviously with CDC and other organizations for years. Our technology is just 2020 updated. Jonathan used the term artificial intelligence. I used the term machine learning. The federal government made a huge investment in electronic medical records over the years. And we just think that, we need to take advantage of that chassis and leverage 2020 technology capable infrastructure like we have to provide real-time input to healthcare, officials and to ensure that we're managing this virus as much in the real time as we possibly can.
And we're here with Jonathan Slotkin and Mike Alkire. We're discussing the opportunities and barriers to implementing the best technology to deal with the COVID crisis. We're going to take a quick break here, but when we come back, we'll hear more about the impact of COVID-19 and some of the challenges when it comes to underrepresented communities. Stay with us. So as we know, COVID-19 is affecting vulnerable communities and communities of color with higher hospitalizations and death rates. How can this technology help address this problem?
Look, this is affecting folks disproportionately. And why is that important? It's important because we need to create resources. We need to do things differently than what we're doing for those specific populations because the word's not getting out appropriately. The technology lends itself well to do that. Now, having said all that, the data is all de-identified. We ensure that we're not having identifiers back to individuals, but we do want enough of that information to ensure that we understand the impacts occurring in those places. And again, our data, because it's zip code oriented, will allow for us to get the right resources across the broad spectrum.
Look, we know at least two things about disparities. One is that if you don't look for them, you'll never find them. And the other is it's how you look for them. So right now, if the medical journals are looking back 3 months ago and seeing disparities, that's important information. But that's not helping us day to day to address emerging disparities, whether it's socioeconomically or racially or otherwise. And so one of the real strengths of this technology being real-time, cloud-based, artificial intelligence-based, is the ability to be finding these things proactively in advance of major surges and waves, including when are certain communities or groups of people being affected worse than others in ways that need additional or special intervention.
Well, obviously a lot of issues to sort out, and we talk at a very high level, I think, about the need to get this technology to these communities, and there's just tremendous red tape involved. So hopefully this will generate some awareness. What are some final ideas you'd like, and I'll give a chance to each of you, what are some final ideas you'd like to leave with us before we close, and tell us where we can find you online?
Yeah, first of all, thanks so much for having me, Joe, and I've really appreciated the conversation. I think that we all need to, have that sobering moment when we realize we're still smack in the middle of COVID-19. So the best technology still need to be brought to bear, now more than ever, especially with flu season coming. When parsing COVID-19 from influenza is going to be one of the greatest challenges that has ever faced healthcare in this world. And with the right technologies, we can really start to get a handle on where things are. Not to mention that further diseases that may come, I think we're all prepared now that something will. We just don't know what and when. Underscores the need for the very best proactive technology. So that's what I would leave people with. And as far as finding me, the subsidiary of Premier, Contigo Health, find us at contigohealth.com and find me on LinkedIn. Thank you.
I just want to wrap up by just saying thank you so much for having me, and you do such a great service for your listeners. We really appreciate the opportunity to talk. And just in summary, Premier, is this very interesting organization that continues to transform healthcare from the inside out. From a supply chain perspective, our focus is to create more resiliency in the supply chain, to reduce our dependence on China and other countries that have a disproportionate amount of manufacturing of both the finished products as well as the interim and raw materials. And we're going to continue to look for ways to domestically manufacture critical PPE and pharmaceuticals, because this country can never be in a place again where our healthcare providers are, potentially at risk because they don't have the appropriate products to care for patients. And then I'd also like to close by saying, thank you to Jonathan and to Geisinger for being that alpha partner working with Premier to leverage machine learning and artificial intelligence, to syndromic surveillance and truly leveraging technology to more effectively manage this COVID virus and ensure that our healthcare officials, our governors, and our other leaders have the appropriate data to manage the population appropriately. You can reach me online on Twitter at Alkire Mike, ALKIRE Mike, MIKE, and on LinkedIn. And be sure also to check out my InsideOut podcast at Premier.com and on Apple, Spotify, and Google.
And you've been listening to Jonathan Slotkin, Associate Chief Medical Information Officer at Geisinger and Chief Medical Officer at Contigo, author of several articles in Harvard Business Review that cover the importance of responding effectively to the pandemic and the role of employers in healthcare. And of course, Mike Alkire, President at Premier Healthcare. Gentlemen, thanks for joining me.
Thanks again for having me.
And that concludes episode 240, but also year 5 of the podcast. Like I said, I'll be back on September 14th. Until then, do enjoy the rest of your summer. Times are difficult, but that doesn't mean we can't have fun, especially with a fall season on the way that's sure to test the limits of our patience, not to mention our fortitude, to say the least. There's a lot going on, but I hope you have a chance to take some downtime this month. And as always, if you like what we do here, we'd love to hear from you. Please take a moment. Head over to wherever you listen to podcasts, leave a rating and review. It helps others know what you think of the show and really helps us out. Thanks again for listening, and I'll see you back here, not next week, but on September 14th. Enjoy.
WashingTECH.